Well, knee surgery's done. I've walked a couple of times. It hurts laying straight in this bed. When I walk, it's not too bad. I have to bend to sit down, like going to the bathroom. It's kind of rough. And I have this little breathing thing. I got to breathe in every hour, 10 breaths or whatever, and it's supposed to keep me from getting any pneumonia or anything. And I have this suction thing on my leg to keep me from getting blood clots and stuff. So every so often it goes off, which I think she didn't even connect it back. I went to the bathroom and and back, so she unhooked stuff so I could go. I don't think she hooked it back. I'll just have to keep moving my legs a lot so it don't blood clot me. But I wanted to give you a heads up what's going on. I went into surgery about 10 o'clock, which I got here about 8:30. And they said that they was going to push me to be one of the first because a bunch of people canceled. But if that was first, oh no. But anyway, I had to stay in recovery a little while longer because my blood pressure went real low. I have high blood pressure, so the medicine really must have done it. But glasses got to glare. Well, when I take them off, I can't really see. But I sneaked and peeked a while ago to see see part of the stitches or the staples. Let's see if I can do it again and show you without them coming in and catching me. When I see obstacles, I create opportunity. When I see adversity, I find a way. When I say never, I say now. Southern New Hampshire University is education made to fit your goals. With over 200 degree programs, flexible class schedules, and some of the lowest online tuition rates in the nation. So when I face barriers, I can break through. Break through at snhu.edu. I really couldn't get aimed up too good. They got ice packs on it too, but so you can kind of see where I'm at anyway, what's going on. If anybody out there is getting a total knee replacement, so far the best thing to do is just get up and walk. The quicker you walk, the quicker you get out of the hospital. And I can do the walking pretty good, but my knee, the degree of matching my knee in has to be a certain degree before they let you go home. And I got physical therapy a couple of times tomorrow, and maybe they'll let me go home tomorrow, but we'll see. My doctor said that the older people usually takes them a couple of days being in there, but since I'm younger, I should probably only be in here one day, so I hope that will be the case. Sometimes I think, go ahead and just let me stay so I don't have to go home, because they're going to start cook this, cook that, and do this and do that, and I never get a break. At least my husband kind of act concerned, getting up and having a hard time getting up, and he tried to help the nurses, and then he's texted me to check on me. He didn't get here until after the surgery, a ways after the surgery, but the doctor be in hopefully tomorrow, and I can find out exactly what went down there, because my mom heard them talking and said something about having to take some extra bone or something. I don't know. I don't think they could take extra bone, because then you definitely wouldn't have a limp or couldn't walk. Or I know they take the bad part out and then put you concrete and stuff like that in the concrete. You got to sing concrete, because my granddaughter said she's going to have concrete in there. Whatever it is, I'm going to put you. And metal, so now I'll be setting up alarms and things like that. I got family that always end up going to their court hearings and things like that. And last time I had some boots, it set the boots set the alarm off. So hopefully they can give me some kind of card. So I ain't gonna do all that. And I might want to travel, and I don't want to think I'm doing something there, doing something weird, want to try to give me a total anal rectomy or whatever you call it. I don't want them examined and all that crap. So I better have a card. Maybe that will work. I don't know. We'll see. Sorry, moving around. My hand was getting tired. I got a spinal thing, so it numbs from the waist down. You're supposed to have less issues. I usually don't like spinals because when I had a child, one of my children, I had one, and I got automatic headaches, and they lasted a long time. Plus, my back hurt a long time. So far, I haven't really had a headache. I was freezing most of the day, but now I'm cold. It was like wintertime for sure, and they say it's pretty cold outside, and but I feel warm now, and she didn't want to change the temperature because it's supposed to get really cold, and then their hallway's really cold, and it kind of just blows in here, the rooms, and makes them cold. Better check my temperature though, because my face is really red too. Well, instead of doing gastric sleeve, I'm doing knee replacements. This was only did one, and it was on my right leg there. Can't wait to really see how far them staples go down or in what direction. I already have a scar on my knee from when I was a kid. I got up on my dad's bed of the back of his truck and it sliced my knee, and I don't know if I got dirt or what in it, but it stayed a bluish color on there, a little puffed up place or whatever. It might not have been the case. It might have been, I started saying, man, I got stitches, but no, I got stitches when I thought I was digging for gold and had my dad's army a shovel and stuck it right into my toe. Anything else to tell y'all so that you might be prepared if you have to have it? Did have to have some tests before to make EKG and stuff to see how my heart and all that was, which I was nervous because I had to take a joint class to know what all was going to be happening to me, and so all that made me nervous. So when I went to have the EKG, they were like, "You're not really nervous, aren't you?" So I had to close my eyes and think of something happy until I calmed down for to take the test. And then they did blood work and urologist, urine tests. And he just told me I couldn't go see any of my other doctors for 3 months. I really didn't need to be around too many people for 3 months. It's a knee surgery. You would think that wouldn't be so important, but they don't want you to get germs and get an infection or anything like that. But they had me want to cancel all my other appointments, and I haven't done that yet because one of them is my medicine provider. If I don't go see them, I won't get my medicine, and that won't be a happy time. So I'm going to have to talk to somebody about that one. I did fix my hair this morning. I couldn't do makeup, of course. Okay, YouTubers, I don't want to bore you. Just want to fill you in a little bit so that you know how things are going, and so if any of y'all have a knee replacement, kind of help you out. I've not done bad on it, so I know people said that you'll be feeling like achy and that it's gonna be really bad. They considered it a major surgery though. They had a list of different things, and knee replacement was on the top there. I was like, well, and for the gastric sleeve, I don't know if I'm going to do that now or not. I don't see any other way, but I've lost the weight before and just got to get motivated to do it again. I've been so depressed for so long that I'm like, I don't care if I'm fat or not. And it's kind of my comfort, just grab something to eat, make you feel good. But it'd be cool to show y'all the progress and watch the weight come down again. That would be nice. Face looks puffy too. It's just fat, I know, but it looks puffy too. Well, Facebookers. See, maybe it's because of the medicine. Who knows? Well, YouTubers, y'all have a good night. Have a Merry Christmas. If I don't talk to you before then, I'm going to try to talk to you before then so that when I do get home or whatever's going on in the next few days, that I can let you know how you're going to feel, how things are going. The numb stuff on my leg is kind of wearing off, so I do have a little pain, but nothing much, so, and I don't, as far as I know, I haven't had any pain pills or anything like, except some Tylenol, and they give me Tylenol every 6 hours. Well, I'm gonna get off here. It's 9 o'clock, which any of you know me, I stay up to 1, 2 o'clock. But I may end up falling asleep early here. I'm wanting them to give me my medicine, that's my regular medicine, because it'll knock me out. But the longer you wait, the longer I won't fall asleep. And then look like their schedule starts with me at 5 o'clock. I ain't going to get up at 5 o'clock if they don't give me my medicine real soon. Well, I'll talk to you later, and y'all have a good Christmas and New Year, and hopefully I'll talk to you before then, but just want to let you know to have that, and I've got to go home and wrap presents. I ordered all of them because I just knew I couldn't get out. I tried to get out the night before my surgery and get some things for the hospital in Walmart, and I like to diet. When I got home, I was about to cry, but of course my husband wanted some dinner, which it wasn't nothing but some soup and sandwiches, but I just didn't feel like standing up there anymore. I hope he lets me recover a little bit before he shoves me back into the kitchen and stuff. I get tired of hearing him complain about stuff being messed up, but dang, I'm in a lot of pain. But he'll say, I work every day with pain. Well, I tried to work, and I couldn't. I mean, I was in pain, and I'm glad that he can push himself and go, but, he's just, oh, I have to, but I don't know. I love him, but man, it irritates me sometimes. I wish he'd get behind me and support me in some things, and we get into a better relationship and nice home. We have a house, and it was pretty. It wasn't the one I wanted, but it's a pretty house, and it's close to my mom. But my grandkids are always there, and they make messes, and it stresses him out because I ain't got it cleaned up. But gosh, it would take 10 of me to keep everything clean because I have different age groups there making the mess. Mostly it's the 2-year-old. He will not quit touching and everything, and then you have to run, see what he's into, and ain't no running with this lady. And time I get there, he's done tore it up or made a mess. He dumped up a bunch of toys in my husband's office the other day, and I had to go in there as much pain I am and bend down and pick it all up. But when I bend down, you could hear and just the awfulest pain trying to get down there to do that. But they tried everything before the surgery. I've had, issues with my knees for about 15 years. And they gave me steroid shots, the cortisone or whatever. And then they gave me silicone shots with that. And I did good for a while. And then the next time I went for the shots, it didn't last but a couple of days. And then I got some more while I waited for this surgery. He didn't do nothing. But hopefully this will get me out and moving about again, and I won't be so far behind everybody else when I'm walking. My daughter and me went to Florida this summer, and I love going to Florida, but it was miserable for me. It was had storms coming, so my body was just aching and hurting. But my daughter would go to the beach there, run to get her little place to sit down, and I'm still at the by the deck or whatever it was and walking through the sand, and she's already sitting down. I'm like, gosh, I'm your mom. Could you not, like, give me a hand or something? At least walk my speed instead of taking off leaving me. If she took off too fast, I wouldn't have found her. But anyway, the family just kind of sometimes aggravates me. They love me, I know that, and I love them. My son hasn't called me or really checked on me. Seen some things on the Facebook where he liked it, but I just hope my family learn to respect me and love me and know that I am worth something. But okay, for those that are getting the knee replacement, you have to pump your feet every so often too to keep from the blood clots. And I keep forgiving. And then this little breathing machine thing kind of line it back like I have to do that every hour. It's kind of hard. Let's see if I can show you. It's hard for me. It might be hard for nobody else. You put it in your mouth, but then there's these little measuring things, and it's supposed to be how high you have to go according to a weight. They tell the number to go, and then right here it has that little up and down thing that tells you where to keep it in the scales. Let me try. One of the nurses said she takes it home just to build up her lungs. Okay. Needed a little bit up there, but I need to keep doing it, I'm sure. Mouth is staying so dry too. I don't even know if y'all gonna be able to hear me. I'm so scratchy voice. They didn't do a thing down my throat or anything, so it must have been some of the medicine or something, because all I got was one of them saddle, or not saddles. Anyway, it was a shot in the back and it numbed everything. And I was so afraid that I was going to be awake and able to hear everything. And I was like, oh my gosh. She said, well, we'll give you some other stuff in the IV or whatever. And so after they gave me that shot in the back, I didn't remember nothing. I just woke up in the recovery room, and they were working on trying to get my blood pressure up. And then once they got it up, they were able to bring me to the room with my daughter and mom waiting for me, my oldest daughter. She shows me a little bit more respect than the others, but my children, they just need some prayer. And hopefully after this, I can myself focused on the Bible and everything else. You know, if you've looked at anything in my YouTube page, I spend a lot of time watching pimple poppers. And need more time in the Bible and not pimple poppers. Pimple poppers are not giving me to heaven. But I thank God that He helped me through this, and I'm doing okay. And we'll just see what tomorrow holds with the physical therapy and stuff. And hopefully I'll get to go home. Well, talk to you later, YouTubers.